A very good morning, students. This is the sagittal section, rather a mid-sagittal section of the female pelvis, and there may be in examination this may be the section given, and you may be asked various questions. Before I ask any question or just reply to any question of the examiner, as it will be asked in Viva, let me have some orientation of this specimen. This is the lumbar vertebrae, L4, L5. This is the sacrum. This is the tip of the coccyx is here. And then you can see the vertebral canal in which the cardiac vena fibers are seen. These are the spines of the L4 and L5 lumbar vertebrae. Then you can see here, this is the concavity of the sacral curvature, in front of which lies, this is the cut section of the rectum is here, this is the uterus is here, okay, the uterine cavity is seen here, and here is the cervix part, so the cervical canal is seen here. Deep to this cervix, you can see, I will put the finger into the vagina. This elongated tubular structure is the vagina is here, okay. Now, in front of the cervix and vagina, whatsoever you are seeing is the cross section or sagittal section of the urinary bladder with the thick muscular wall. Okay, its continuity with the urethra, female urethra, is not seen. In front of the urinary bladder, this is the pubic symphysis is here, okay. Now this section is not exactly in the midline, hence will not show the downward continuity with that of the vestibule of the vagina, okay, or the labia majora and minor part will not be seen. I will try to show you in the other section. Okay, I hope that you have got a fair good idea about the cross section. Anal canal has gone to that of the other half of the section in this case. Okay, so when this section is given to you in the examination, many questions can be asked on this. The first question may be itself on the identification of the organs, okay. So examiner may ask you, identify this structure in the sagittal section. You may start answering right from anterior to the posterior side. You answer that this is the pubic symphysis or the cut section, sagittal section passing through the pubic symphysis, and posterior to this pubic symphysis there lies the urinary bladder. So you can say that there is the urinary bladder which lies posterior to it. Okay, then posterior to the urinary bladder you can show that this part is the vagina, and then this is the cervix, and this is the uterus is pierced uterine cavity is there. Then you can say that posterior to this vagina there will be the longitudinal or mid-sagittal section of the rectum, and then it should continue with that of the anal canal right up to the anus, which it is not continuing here. Then you can also show about the vertebral column, the sacrum, the sacral canal, you can say that like that. So this may be the first question which usually the examiner they ask before they ask the other question. So the identification of the structure in the sagittal section is there. Now, then he may ask a second important question is that what is the peritoneal relation of this pelvic viscera? You can say that the peritoneum comes from umbilicus here, covering to the lower anterior abdominal wall up to the pubic symphysis. Then it comes and covers a small part of the pubic bone here and the symphysis. So this is that part which is covering the uppermost part of the pubic symphysis. Then this peritoneum is reflecting onto the superior surface of the urinary bladder. From the superior surface of the urinary bladder, then this peritoneum will be slightly dips, okay, in front of the cervix. This is the cervical part of the uterus, so it will slightly dip into the cervix, and then it will be reflecting onto the anterior aspect of the cervix, and then it will go to the anterior surface of the uterus, then it will cover to the fundus of the uterus, okay, then the posterior surface of the uterus, then this peritoneum will go down below, covering to the posterior surface of the cervix, and then after covering to the, it will touch to that of the uppermost part of the vagina. That means the posterior fornix of vagina, as I am trying to show you. This is the posterior wall of the vagina is there at its junction with the external os of the cervix is here, and then you can zoom it if you are not seeing properly. And then this peritoneum, you can see that it is covering to the posterior fornix of the vagina, and then it will reflect onto the anterior surface of the bladder. Sorry. This is the rectum. Then it will reflect onto the rectum. Thus, this will go then onto the anterior surface of the rectum, and then to the colon. Okay, the sigmoid colon. It will just go here. This is the portion of the sigmoid colon is here. So it will go. So this is the peritoneal reflection of the pelvic viscera in the sagittal section, mid-sagittal section. It is like that. Then this third question may be there in relation to this is that try to show the peritoneal, okay, recess, or it is the pouches, okay. Now most important pouch is here, which when the peritoneum reflects from the posterior surface of the uterus, then onto the posterior surface of the cervix, and then it comes to cover the posterior fornix of vagina, and then it reflects onto the anterior aspect of the this rectum. This pouch of the peritoneal fold, okay, it is called as the recto-uterine pouch. Okay, this is known as recto, and it is covering, since the posterior fornix of the vagina, this covers a small portion of the vagina, as you can see here. And if you pass a finger in a patient through the vagina, okay, just below the external os of the cervix in the posterior fornix, you can come in contact with the recto-uterine pouch, okay, recto-uterine, which is also known as the pouch of Douglas, which has many clinical importance, since it is the most dependent part of the body. The pus, the blood, the peritoneal fluid, all they collect here, and they can be drawn here by putting a needle in the posterior fornix of the vagina, which will be easily, very close here. Posterior fornix of vagina is just in relation to the pouch of Douglas or the recto-uterine pouch. Okay, that can be the fluid can be drawn from here. Okay, it can be drawn from here. Now then, another is reflection of the peritoneum from urinary bladder to that of the anterior surface of the cervix, okay, and to the uterus anterior wall is called as the utero-vesical pouch, which is not as deep as that of the recto-uterine pouch or pouch of Douglas. You can see here it is going deep, but it is quite superficial. Okay, vesico-uterine pouch, it is called as the vesico-uterine pouch, which is not of much significance. So that may be another question can be here by examiner. Now after that he can ask you where should be the opening of the perineal body. Okay, the perineal body of this will be somewhere here, just between the anal canal. Okay, where the anal canal is just turning and having the turn, which since it is not a mid-sagittal section, I just cannot show you here the perineal body. Okay, then there may be the other vestibules of the pouches of the vagina. Okay, That means the posterior fornix, there may be anterior fornix, and then there may be a lateral fornix of the vagina can be there. So this may be the various questions. Okay, if there would have been the anal canal also cut here in the mid-sagittal section, then he may ask you the what are the different parts of the anal canal, that is white line, the pectinate line or the pectinate valves, and then the junction of the mucous membrane and the anal canal can also be asked by the examiner, but here it is not seen. Now I just stop here and will just show you another specimen where the fornix are better seen, okay, or the vaginal fornices are very well seen. Thank you very much for watching this video.